Hello. Hello, everyone.
Hello, Jan Hatcher-Roberts.
Nabila Khalid.
Hi there, David Zakas here.
Paivi Abernethy is here already.
Hi there, Krishna here.
Hi there, this is Sibrit Sukting.
I'm Don Sutherland. Hello, David.
Hi, Blake Poland here.
Hi, so I'd like to welcome everyone and good afternoon, good morning to the people here on the West Coast. I'd like to welcome everyone to the webinar and thank you all for joining today. I think we're just going to wait a couple minutes to let more people join in and then we can get started.
Hello, Laurel. I see that you're on. You can ignore my email.
Hi there.
That was Dawn sending you the message. Hi, Emily. Emily, you're muted.
Thanks, Don. So my name is Emily. I'm the coordinator of the Students Young Professionals Network. Thanks everybody for joining us today. We're really pleased to bring you this really relevant webinar. And it's been put on today in conjunction with the SYPs from the British Columbia Coalition Institute Community of Practice, as well as the Coalition's Climate Change Working Group. I'll introduce our moderator for today, and then I'll pass it over. So our moderator today is Krishna Todi. Krishna is a master's candidate in public health with a concentration in global health and is also the BCCI SYP representative for Simon Fraser University. So over to you, Krishna.
Thank you so much, Emily. So I hope everyone's doing good and is all safe and healthy during such trying times that the world is facing today, first and foremost. So before we get started, there are some housekeeping notes that I want to mention. The webinar platform uses teleconference for audio, as you're given the dial-in details already. So please make sure that your microphones are muted unless you're speaking, which will happen towards the discussion session. If you have any questions during the presentation, please feel free to type them in the chat box, the button for which you'll find at the bottom. I hope you enjoy the presentation and we'll have time for questions at the end. We're also recording this session and we'll be sharing the same with you afterward. So as for myself, my name is Krishna Todi. As mentioned by Emily, I am a final year Master's of Public Health student at Simon Fraser University and also the SYP representative from FSFU for the BCCI. The BCCI is a dedicated platform for an innovative and localized model of the CCGHR. Similar to earlier coalition institutes, BCCI's current theme is planetary health, global and local. So for those of you who are not familiar with the working group, on the health impacts of climate change. It was in early 2018 to address the challenges at the intersection of health and climate change. The objectives are to identify the knowledge gaps through individual and institutional members, to communicate the current state knowledge and awareness of drivers for and changes in climate-related health. So one of our activities to help address this is webinar series, for which today's session is possible. So today we're presenting on climate change and health, working with First Nations. So as highlighted in the recent IPCC reports, Indigenous peoples have a key role to play in helping to develop more sustainable governance models to dealing with climate change in Canada. We often talk about vulnerabilities and risk assessments, but fail to acknowledge the structural and process-related inequities imposed by our own surveys and other academic inquiries. Similarly, we fail to be self-reflective about our privileges as academic researchers and explicit about how we need to share power in our climate health research projects. So the goal for this presentation is to provide a more nuanced picture of climate health research than is usually discussed, emphasizing especially aspects that First Nations tend to pay more attention to. The webinar will also discuss climate change impacts on health and power asymmetries in climate health research, as well as highlight the potential leadership, the role of Indigenous peoples in addressing climate health challenges. I'm particularly excited for this webinar as we have our amazing presenter today, Dr. Paivi Abernethy. So Dr. Paivey is a climate change and health specialist with the First Nations Health Authority, research fellow at the University of Victoria, and adjunct professor in the School of Environment, Resources and Sustainability at the University of Waterloo. She has been working in sustainable, healthy community development with Indigenous and rural communities since 2005, focusing on social, ecological, and Indigenous determinants of health and community capacity building. Her work centers on impacts of various environmental factors on community and ecosystem health, ranging from climate change, pollution, and natural resource governance to cultural and socioeconomic influences on health. So with this, I hand over to the platform to our presenter, Dr. Paivey.
Krishna, we may need a second here. Paivey just got bounced out of the call for some reason. So I'm just working with her right now to figure out why that is. Just hold on.
Okay, no problem. So we might just wait a couple more minutes here for our presenter.
Can I ask a question while we wait?
So our presenter is having some technical issues and she got logged off this platform for some reason. So we're just waiting for her to figure out and come back on. She'll be on in probably a few moments. And Blake, to answer your questions, yes, you're supposed to be seeing the slides, which will be shared by our presenter. Perfect. So I think we have.
Hello, sorry about that.
No problem.
No problem.
Paivey. The platform is for you now.
Okay, and I'm sorry, for some reason the system kicked me suddenly out just when we started. So I hope somebody is still there, and I didn't hear anything that you said. So thanks everyone and welcome. So I'm actually one of the members of the CCGHR's Climate Change and Health Working Group, and I hope you are all well in this COVID madness, and today's talk will not mention the virus again. I actually mentioned that only because I find our collective inability to think and operate in complex systems really little disturbing, because we focus on one thing right now, which is incredibly important, but as all the other important things fall to the wayside. And I hope this talk stimulates and revitalizes complex social ecological systems thinking in health research and generates a good foundation for future collaborative work and research with First Nations climate leaders and more strength-focused research in general, because in health research, we tend to focus way too much in deficits and challenges without looking on assets and strengths as much. So first, I wanted to wish you all a good day. I want to start by acknowledging that I live, work, and play here in the unceded territories of Sauk Nation. And I actually want to express my gratitude for their warm welcome to me and our family about 4 years ago when we moved here from Ontario. And I'm not even trying to pronounce that, since I don't master the language here. So first I want to start with the talking points I want to share with some of the take-home messages that I will be covering. This is not your typical research talk, for simple reason is that I want to also make a point. I will talk about my own research just superficially. And the objective for me here is to talk about alternative research problem framings and ways in which we could better work more effectively and more meaningfully with First Nations in climate health research context. And you are probably, since this is a group of people already working in climate change, very familiar with some of the perspectives and science that I'll be talking about. But I hope that my multidisciplinary background will offer you some new food for thought in relation to climate research, climate health research, and First Nations, and information to those who don't know much, and overview for those who already work with these issues. So first I want to situate myself because there are many approaches to climate health, and I even talk about different approaches and aspects depending on which hat I happen to have on. I am, as you mentioned probably before, is that I'm Adjunct Professor in Environmental Studies. I am research fellow at, that was U Waterloo, and I'm research fellow at some context, and some context I'm the climate change and health specialist with FNHA. And when I talk about climate health, I talk about climate change impacts on health. So first I start about my context. It's very vital for me to state, as which you probably hear from the accent, that I'm not Indigenous here in North America and not representing or speaking on behalf of any First Nations peoples. If in any context of anything that I'm representing, in some aspects, sometimes I am representing the First Nations Health Authority, and here today I'm actually representing myself primarily as a researcher. So I'm an academic and research practitioner specialized in public health and sustainability governance, particularly in children's environmental health and chronic disease prevention, climate health, and bringing together different ways of knowing for better policy and decision making. And I am also a Savonian, which is one of the two eastern tribes. I'm North Savonian, actually, one of the two eastern tribes in Finland. And I first arrived to Canada from actually Denmark just 20 years ago, so I'm also a new Canadian. But I have been working with First Nations since 2005, and I've actually worked with nations from across the country, from Eskasoni, Mi'kmaq in the east to here on the west coast, as west as you can go, because I live here, but also Northwest Territories with Dene. And my focus is on any kind of research that and work that helps empower communities, and by primarily helping them to work with different ways of knowing. So that's all about me. Right now there is a picture that sort of dates me. It's from our family summer camp, or where my grandparents used to spend all their summers way back when. So I start with an example that is not actually my own research, but just to illustrate the key piece here is that bringing together different ways of knowing, to highlight one of the two critical aspects that are critical to my work, which is bringing those different ways of knowing together in a meaningful manner. And this paper is one of the better ones that I have seen that illustrates the value of bringing together Indigenous and Western knowledge. And that two-eyed seeing is a concept coined by Eskasoni elders Mordena and Albert Marshall. And Eskasoni are the Mi'kmaq on the, in Nova Scotia. And then Dr. Gerald Bartlett from Cape Breton University. And it refers to learning to see from one eye with the strengths of Indigenous knowledges and ways of knowing, and from the other eye with the strengths of Western knowledges and the ways of knowing, and learning to use both those eyes together to benefit all. And that's a term that is becoming more and more common in academic research, but I also want to highlight the dangers in it for those of you who are interested or working with First Nations communities and haven't done that yet, possibly, is that that is not a universal term. It's been adapted by the academics because it was first time connected to the academic literature. But there are some communities, even here on the West Coast, are using it, but then there are others who have their own language. So, for instance, Kamloops and Skitchen, who developed their own environmental impact assessment. That's two tribes living in what's called Kamloops, and it's in those territories. It's their territories in Kamloops region. And they developed the environmental impact assessment using Indigenous approaches to illustrate how to fight Ajax mine in their territories, and they use the term walking on two legs to illustrate how you need balance. So every community is different, and I will highlight that several times, so bear with me, because they have different stories and different concepts. And so when you're working with communities, or we should never assume anything. It's more important to ask and listen. The more I learn and the more I know, the more I notice how little I know. So I usually just open up and start from scratch every time I work with a new community. So Darlene, just wanted to say that Darlene Sanderson, who co-authored this with the Stellatan Nation and the scientists participating in this research, is a Cree professor from Thompson Rivers University in Kamloops. And I wanted to highlight two particular points here. And one is that quantitative methods in Western science are often limited by their hypothesis, meaning that they assume some things and are testing the hypothesis and assumptions, and that can be limiting and missing critical aspects of complexity that is needed to deal with the real life situations, in particular in this kind of climate health aspects. And that came out from this research too. And same time, I also want to highlight that when we think about traditional knowledge, like not all Indigenous knowledge is traditional knowledge, and that's a whole different discussion itself. Elders and knowledge keepers who are have carried traditional knowledge, they are sort of PhDs in their communities, and then there is the local knowledge, which is also incredibly valuable and important, but just also the terminology wise is important to think what is there, and what is the knowledge that we're collecting, and how do we validate it. And each knowledge system needs to be validated by their own merits. So a good way for researchers to work in is to validate also the knowledge by making sure that community agrees what they found. But the key piece in this research was that it really highlighted how some of the aspects would have been missed by the Western approach if the community hadn't been part of with the traditional and local knowledge in the research. So before I jump more into the climate health aspects, I want to highlight the two aspects of my theoretical framings, and this comes from being a multidisciplinary. So empowerment is incredibly important, and current approaches of creating baseline, for instance, for climate action is very narrow and usually involves and focuses very much in vulnerabilities and risks. And even when we talk about adaptive capacity in these assessments, climate assessments, we talk about adaptive capacity as it's something static. It's something that is, and then nothing happens to it. Whereas the strengths-based approaches that I focus on, and where there's a very strong theoretical foundation, which you can study from Wallerstein's or Laverack's backgrounds, literature that I put in there, is that that creates ownership and empowers communities, and it's really key piece in actually moving action forward, and critical element of healthy in building health and creating health. And I just to add here is that since this is mostly health researchers, so I'm not going to explain much more, but it's a Marmot study of English office workers that showed that government office workers who had otherwise similar environments where they work, the health was very dependent on their status in hierarchy. And that reflects that empowerment aspect, that if we feel that we have a power to change things, then we tend to be healthier. And there are studies that most of you probably are familiar with. The other thing that I really focus on, which comes more from the environmental studies side, health hasn't touched this too much, is that there are huge power asymmetries even in research, let alone in all these community-based approaches. And I just wanted to highlight here how our own language and the way we frame problems and the processes we choose to use as researchers are also based on that dominant Western scientific paradigm, and that unintentionally imposes power over Indigenous ways of thinking. Even if you look at the examples that I put on the side, which are two supposedly empowering documents. The one is the BC Bill 41 that ratified UNDRIP in BC. So it actually talks about the rights of Indigenous people as an essential part of that law. And the other one is from residential school financial support for residential school survivors. And even the program eligibility is formed in a way that is challenging. And I have several friends who are highly educated, so university professors, Indigenous university professors who went to residential schools and didn't want to participate in this, but finally did it because of the pressures, social pressures, and wanting to support their communities, but that they found it very re-victimizing and dehumanizing and disempowering the whole process. And this is the thing that I want to highlight with these external examples of how, as academics, our quantitative questionnaires can be very intimidating, or depending on who is asking, like if we're not hiring community researchers to do the thing, then even the process can be intimidating. Most Indigenous people in Canada are bilingual culturally because they went through the school system, but if we want to respect the culture and demonstrate it in practice, it's important to work in the early stages, even the way we design research. So thinking about how power operates through us and what we consider acceptable forms and expressions of knowledge is really critical in working with First Nations, and this is my interest in research, to study that. So I'm at the same time sharing this with you while I'm also focusing my research on this. And then we get to the real topic, climate change and health. And it's kind of, I always find awkward when it's not interactive, but let's start here. Is just to summarize, I'm not talking more about this. This is just to highlight the increased CO levels and carbon dioxide is not the only greenhouse gas, not even the worst one, as you know, but this is basically just providing the overview on the pathways, that the way I think, and the ideas that are important. Acute health threats and long-term health threats are the two that I separate, which is very seldom separated in our literature, academic literature, for the time being. We talk a lot about things in a nice mishmash and compare apples and oranges and don't think about the pathways. And here is an example about the pathways as told by BC government. I actually really like this picture in the terms that it simply highlights, forces us to think about the natural and built environments and the community and social factors and livelihood factors. And then at the bottom, there is the lifestyle factors, where I throw just that. I want to highlight the health inequities that we have, because the structural unfairness and all the residential school and racism and resource extraction, cultural genocide, all that has traumatized the communities that we are working with when we do conducting research with them and for them. And that's quite key piece to keep in mind. But in general, I want to focus in this particular brief talk only on those health impacts, climate health impacts, that are rather unique for First Nations. And the short-term impacts, I wanted to highlight these coastal issues. There are many others, but basically here in BC, somewhere 30 to 50% of Indigenous communities are actually out coastal. There are over 200 communities, and there are almost 100, I think it's about 80, 85, somewhere there, communities that consider themselves coastal. And these communities are nowadays having significant problems with these algae blooms, toxins, and bacterial infections. There was a cholera outbreak in herring eggs, and this is an example. We're having a paper coming out of the response to that and how you engage Indigenous communities in a meaningful manner from the get-go. But the illustrating the climate change problem here is that so cholera bacteria is associated with warming waters, in coastal warming waters, and herring egg is one of the key, one very important component in traditional foods here, and it's in many communities even raw. So the public health measures that saying, okay, so boil your eggs is not really effective, and it doesn't make any sense for communities. So there are these kind of cultural challenges in addressing climate change and health. There are also issues with the monitoring, because a lot of all the monitoring with the Fisheries and Oceans Department, DFO, is happening they focus on the commercial fisheries. So there are very little of information available for communities, but I'll talk more about that later. So the other aspect of looking at the climate change and health that we also don't discuss very much is the long-term, the land and water cycles and the food system. And that really impacts First Nations here, because a lot of the communities are rural. And we all learned, or those of us who learned at school, that forest fires are a good thing. And now we are discovering that the forests are actually not growing back very well here. And this here is, again, the part of the essence that I'm trying to highlight is that there is a lot of traditional knowledge in First Nations communities, and now I focus on the BC, but it's the aspect that traditionally First Nations here actually practice controlled burning to avoid big fires. And there are studies both in here in the interior and then in Washington and Oregon, so scholarly papers about the effects, how that actually reduces climate change. And that falls outside of a traditional, conventional health research, but at the same time for First Nations that is not separated. So when we're doing health research and looking at the health impacts, it's looking at the whole and thinking of empowering communities to think about how can they address actively proactively ensure that there aren't fewer forest fires, and hence the health impacts are not there, the negative health impacts that come with the forest fires. And there are multitudes of issues with various food sources that impact also the First Nations. And I'll talk more about that later. I wanted to highlight here that climate change doesn't happen in vacuum. So the systems thinking of there is for the First Nations health, and I talk a little bit more, probably should have had that first, but is when we think about salmon is I use salmon here as an example, is that it's a keystone species, very important traditionally for most coastal nations in one way or the other, and depending on what species it happens to be. But there is its impact, climate change impacts its spawning and harvest seasons. The fish come at different times. The temperatures are too high. The water may be too high temperature for the reproduction. There's less fresh water, so they can't come up the rivers. The oceans are more acidified, as well as the fresh water, because there is more carbon dioxide in the water, and the water more than ever. And so there's some acidification taking place, in particular with more shallower waters. And that impacts the reproduction of the salmon. And salmon is so essential for the cultural identity. So that starts impacting both mental, spiritual health. And there are the toxic plumes that I talked about, and various contaminant releases that impact because the warmer temperatures release chemicals. They change the balance of equilibrium in between sediment and the water. So these are all indirect impacts and long-term impacts that can have severe impacts on Indigenous health. And if we as health researchers don't look at the whole and think about that, I think we are not getting anywhere. And this, I assume that all you can read this, but it is basically is that worldview aspect that I wanted to highlight as a key piece here in trying to understand how First Nations have historically had a very different approach to their environment. Most languages don't even have such terms as nature and environment because the cultures see themselves so centrally as part of the environment and as part of the land and the water. So when we're talking about Western environment, it's better terms is lands and waters, but it's also the innate stewardship, sense of rights and responsibilities to all our relations that we are connected to. And as a biochemist, I think that for me, we are, from Western science perspective, we are mammals amongst mammals. So we are not separated. We are DNA coded beings that are really dependent in the same way on one another, other species, be it plants or water and air. And I just had this here just to illustrate that difference in our contemporary Western scientific paradigm that very often puts the man on the top, and then that relational, more relational worldview of the ecocentric perspectives. When I want to introduce you to this concept, this is a tool, if anybody is ever interested in, also published both scientifically and EPA's websites, the tools how to work with, and can be adapted to use, and that will help work with health concepts from different worldviews. If you go to a First Nations community and ask what makes them healthy, it's not necessarily let's say they don't talk about their BMI or a glass of how many glasses of wine they can drink or what impacts health. And this was developed by Jamie Donatuto, who is a toxicologist. She got her PhD at UBC, but she's American. The Swinomish Nation, where this is developed, is south of the border. And she worked with an elder, Larry Campbell, and they've been working on this for about 20 years now. And it started by by Jamie realizing that the toxicological measures that she was looking at health, they didn't make any sense to the community. And even her findings didn't really mean much. So this just highlights that there's a participatory approach to this, and Swinomish Nations identified community connections, self-determination, and balanced education, natural resource security, and cultural practices as their key indicators for their health. But this is different from community to community, and that's the other take-home message that I want to highlight, is that every community is different, and this is just a tool to work with them. And this is something that I am learning to work with in my research and work with the First Nations Health Authority. Food is very central. The traditional food is very central for the climate health discussions in First Nations. Anytime there is, it's almost anytime there is any community, it comes up in one way or the other. And it's central to recognize, because these are things that I didn't know, and I used to work as a community health promoter in Northern Ontario with First Nations communities and about food systems, is that I knew that the traditional food is superior nutritional quality, and Larry Chan's the First Nations food environment and contaminant study demonstrated that nicely. There are quite a number of publications. I put one there. But what I didn't realize until I started working on specific projects here in BC is that most First Nations people eat traditional food, and it is much more than nutrition, even though it's most nutritious. It's soul food, it's part of identity, it's part of social connections. It's sharing food is really essential part of the culture. And yet at the same time, all this resource extraction and climate change cumulative impacts are threatening that. And this is now BC. There are studies across the country, but because I focus on BC, is that there is, it's disturbing that there is food insecurity in almost half of the families, and 25% of households with children are having food security issues. So losing even more access to traditional foods because of climate change is very detrimental. And it's these kind of studies that really are probably needed to how to counteract that type of things. From the health perspective, this is just a quick overview. I already said some of these things, is that there is lack of access, and that leads to obesity and chronic diseases because people eat much less nutritious white bread, processed foods. Climate change also leads to different ways to contaminated foods and medicines, and that's a different talk. I can't put everything in half an hour, but but I mentioned the infectious diseases from cholera, like the cholera eggs, acute toxicity from the toxins in algal blooms, chronic diseases, and developmental origin of health and disease. So different exposures from chemicals, for instance, or that are released because of climate change. There is a further loss of identity and cultural social fabric and spiritual aspects and socio-economic impact pathways, because a lot of people are dependent on the sources of their hunting, fishing, and forestry, community forestry. So these are things that we know, and when I'm talking about asset-based, it's important to recognize the problems and maybe document them, but at the same time, I think for us as climate health researchers, it's critical also to empower people. And I sound very advocacy oriented here, but I think if you work with climate health, that's what you sort of become. And this is something that I have been instructed by my Indigenous colleagues not to ever forget. So I am sharing this with you because rights-based approaches we often forget. Aboriginal rights were originally defined in the Royal Proclamation in 1763, and an Aboriginal title has been recognized in common law in Canada since 1888. And I want to highlight this because this is something that the non-Indigenous researchers often completely miss. And this is something Indigenous peoples on this land actually expect you to know about. So the Royal Proclamation stated, any lands that had not been ceded to or purchased by us as aforesaid are reserved to the said Indians. It also recognizes that the Aboriginal lands are reserved to them or any of them as their hunting grounds, which in a sense defines Aboriginal right as the right of the First Nations to harvest resources from their traditional territories. And so this has been sort of modified or added to, and there's the three concepts that I think that you need to know is the United Nations Declaration of the Rights of Indigenous People, because it really highlights, it establishes the universal framework of minimum standards for the survival, dignity, and well-being of the Indigenous peoples, which is based on human rights standards. And it emphasizes the rights of Indigenous peoples to maintain and strengthen their own institutions, cultures, and tradition, and to pursue their development in keeping with their own needs and aspirations. And this is, BC is completely unceded territory in the terms of there are almost no treaties, but this is also valid for the treaty nations across the country, because that's what the treaties are about. That's what was negotiated. And Bill 41 is the first. So we have acknowledged the UNDRIP in Canada, but we haven't ratified it yet. There is the talks and there's a lot of confusion about it, but BC was the first province that actually ratified it last December. And then the third piece that I don't know how many of you are aware is that Section 35 is really key. And that's the Constitution Act from 1982, which states, it has multiple steps, but the first segment is the existing Aboriginal and treaty rights of the Aboriginal peoples of Canada are hereby recognized and affirmed. So when you are working with Indigenous communities in Canada, they are, as said, and see themselves as nations. And so we are not dealing with municipalities or communities the same way, even though they're operationalized partially the same way because it's smaller communities. But I think that's a key piece even in health research, to realize the rights-based approach that in climate health research. And there are changes. I'm looking at the time, so I'm trying to go a little faster because I started late. But there is a change in the air because IPCC reports have heavily focused on Indigenous peoples lately. The one in June 2009 highlighted the findings that show that lands governed by Indigenous peoples are significantly healthier and less damaged than those managed by non-Indigenous people. And in September, they actually explicitly stated that that maybe we should learn, maybe the values, not even maybe, the values of the Indigenous people are probably quite critical and central in addressing climate change in contemporary context. So then I move on to the community-driven research that I focus on and that I think is very strongly recommended and desired by communities. But before that, I want to just cap here is that stewardship is central. I haven't yet met an Indigenous community that doesn't focus on collective good and intergenerational responsibility and having the relationship with the land and the waters and the air and other beings, and focus on 7 generations. But that said, that every single community is different, and there are really significant cultural differences. And having worked extensively in Northern Ontario, and then here, it's like take differences between Finland and Italy, or Russia and England. So it's, and even within just here in BC, even within 100 kilometers, the communities can be very different and language is very different. But the essence of the aspects that I'm trying to highlight here, maybe for the research perspectives, is that when we look at the health impacts and recognizing the health impacts and monitoring them, it's really central to focus on the strengths in the communities and demonstrate and study also the leadership that the First Nations are showing. And I mentioned the Swinomish Climate Change Initiative and the health indicators they have developed. But I also, in Canada, the Guardians, they don't talk much about health, but what they work with is health and climate change in the reality. So it's just to illustrate that there is a lot of different types of leadership, not just in BC, but all across Canada. It just doesn't get studied or worked on. And I think there's a great potential in health researchers to start actually working with that. And here are the key pieces that First Nations community work has taught me, is that there needs to be strengths-based, comprehensive approaches that invite all the people to the table. This is Tunaha community that did their comprehensive community planning, which is funded by the federal government here in BC particularly. I don't know about outside. It's a specific toolkits, and many communities don't have resources to do that, but to do them alone. But that's where I personally see that us researchers can play a huge role in working with communities and bringing the health lens to these conversations more explicitly. It is when the communities are working, it always comes up, but these are the things that we can learn from too, and at the same time support communities in reconciliation and building their own strengths. Here's the other aspect that I have found very interesting is I talked about the controlled burning. There are many others, but clam gardens is one that actually is an example that many communities here are now starting to look at as an alternative food source, because food is key piece in health and climate change adaptation. Clams, for whatever reason, seem to be most stable and resilient in terms of acidification and warmer temperatures for the time being. And clam gardens was actually one form of agriculture here on this side of the coast. I don't know if it was also on the other side, because First Nations here on the West Coast, that this was the hub where there was a lot of strong business going on and trade networks, and like from the Kamloops area, there were copper plates that have been found up in Alaska and down in New Mexico. But clam gardens, Haida, there was some archaeological study that demonstrated in Haida they had been doing it at least for 3,000 years. And now it's something that we're revitalizing because the fish stocks are collapsing. And other food sources, traditional food sources, are really disappearing. And there is also the stewardship aspect that people don't want to eat something that is sparse, because that's so fundamentally ingrained in the thinking that you do not deplete your relatives and kill your neighbors. This project that this is actually one type of research that I'm working with, but I'm skipping this more, but this is an example of how communities choose to work with climate change, climate health adaptation when they are given money and they can choose their own direction. And this is one in the northern British Columbia that involves school and the Bandout Environmental Consulting Agency, Council Health and Lands Departments, elders and scientists. It's classroom teaching and land-based learning about the traditional harvesting and community gardening, and GIS mapping and strategy development. This is what communities do when they do their research, and no researchers interfere. So there's a huge potential of working with. This is a strong community. There are not so many communities that are as strong. There's a ton of leadership that I could tell more about, but I can see we're running out of time because I started late. These are communities that I've worked with, not Tsauk Nation, but Henry Inlet and a little bit with Kanaka Bar. And these are visionary people. And we are also, I'm leading a project in Health Adapt about developing community-driven monitoring systems, which I mentioned previously that there's a huge concern of identifying what food is safe and what is not, and developing systems and mechanisms. We have Health Canada funding from two different sources for this. And this it also includes implementation phase, so that includes teaching for kids so that it doesn't disappear in the first, when somebody leaves a job. So we're training communities from kids up. Another aspect of health is co-governance and the empowerment. And I'm working with Cowichan Watershed Prod to see if they have needs to do some research on health aspects. that's one of the good examples of Indigenous and non-Indigenous people working actually in full collaboration, so that there is half and half of the board is Indigenous and the other half is non-Indigenous, and that has and they are focusing on health of both the people and the environment, and more to be heard later on. And my other emphasis here is this thinking about systems thinking, is that also recognizing the knowledge and the rights has been demonstrated by other scholars that is central to improvement of health among Indigenous peoples. And I'm sorry this got so quickly end here. If you have any questions, now is the time, and I hope we have a couple of minutes to answer. I can send you emails if you have questions.
All right, so thank you so much, Paivey, for the wonderful and super informative presentation. So now we can open up the session to questions and discussions. So just a reminder, you can type your questions in the chat box. You just have to click the chat button at the bottom. And make sure that you're sending to everyone. You could also send the question just to myself so I can see them, or you can just unmute yourself and we'll be able to hear your audio. So just because we started late, the webinar is now pushed a little bit more, 15 minutes. So we're gonna end at 2:45 instead. We apologize for the inconvenience. So yeah, the platform is now open to questions.
I figured nobody dared to ask anything. Maybe this is so different for the conventional research.
Absolutely. If someone wants to talk their question out, you are free to do so. All right, so Paivey, we've got 2 questions already. First is from Anna. She wants to know if you can elaborate a little bit on the cholera outbreak, and also a bit of your experience working with Indigenous communities.
The cholera outbreak, I was not part of that. I am just the one who did the assessment and evaluation afterwards. So cholera outbreak was, it was discovered that there were some individuals getting sick, and then you do this is actually a huge question in the terms of also explaining how the whole health system works in BC. Let's put it that way. I'll summarize it very quickly in the terms of so BC has a unique situation in that there are provincial health authorities, 5 regions, and then there is a First Nations Health Authority, which is a unique combination because normally Indigenous health historically is funded by federal government, and each community needs, or tribal council, whichever way people have organized themselves, has to apply for every single program separately in public health programs and like in child development and a lot of other things separately from the federal government. And in First Nations here, the 200 almost of them got together and decided that they established First Nations Health Authority that was established 2013, which takes some of those responsibilities and applies funding and works together with regional authorities, health authorities, which is a completely different system than from other provinces for that matter. But so this whole outbreak was that it was identified that there were people who were getting sick, and it was discovered that it was possibly from the herring eggs, and then it was discovered that it was cholera, but It took a little while before it was identified which strain, that if it's the cholera that really kills people, or if it's a strain that is just causing mild diarrhea and discomfort. And so in that process, to find out, to do the detective work, to find out where the sources were, who the people were, and how it could be best addressed, and how people should be informed, and what should be closed, should fisheries be closed, and so on and so forth. That is the public health response system that actually is in place, and then how to adapt that to, how to make sure that communities have that information. So that in itself is a paper that is coming out. So I refer to that paper, but it turned out not to be the cholera that is the most dangerous kind, but this experience demonstrated how the FNHA's close trust relationship with the First Nations really speeded up the process and helped to develop effective interaction and collaboration. For instance, the First Nations that were most affected, they were loaning their boats to go and collect samples, and showed where they were harvesting, and told about their ways of processing food and stuff like that. And that's a key piece that goes missing if you don't work with the communities and you don't have the trust relationship. So that was a long answer about that. My experience working with communities comes from everything from living in Northern Ontario, which means you're working and living with First Nations, in my case. So my experience comes from lived experience outside of work too. And then I have worked as an environmental consultant with Indigenous people. I have worked as an Aboriginal health promotion specialist across Ontario for Cancer Care Ontario. As a community learning series, so that was more provincial level, superficial. And then currently I am back to being provincial, working across BC with all 200 nations. So it's limited in that case now what I'm working daily with communities, but I have both the daily and the provincial level experience.
Perfect. Thank you so much, Paivey. So our next question is from Jocelyn Radcliffe. She wants to know, how do you recommend researchers initiate relationships or just work within the communities? And are there any network that you can recommend that she can liaise with or we can link up with?
So where was she from?
It's not mentioned.
Okay. So there are different ways of, depending on what level of work you're looking at and research. First Nations operate and are very context specific. So local and sub-regional is a good way of working with communities, but of course you need all levels. So depending on the level, there's a regional way of working, and then also there are provincial organizations and national organizations. So if you're interested in national level organizations, that's AFN, and they work in a lot of research projects. There are regional level. It would be actually easier if you sent me an email, and then I can guide in the area that you are in, the province, because it depends a lot on the province and the topic of health. And one good way is just contacting communities of interest, or actually, now I'm rambling and ranting, because communities are also very tired of people just coming in. So you oftentimes want to build a relationship without the problem first and do something. So I think it's a much more complex than that, but I'm more than happy to have a discussion to explore one person's situation and guide in that aspect. And First Nations organizations there are tons of them. we just did the screening study on the health-related organizations within certain areas here in BC. And there are disabilities or people working with Indigenous disabilities. So finding an organization by Googling and reaching out is probably easiest when you're not familiar, and then they can lead you either to the communities. Other way is health directors in BC, Indigenous health directors have their own organization. So Google is an amazing place to start finding things.
Perfect. So Jocelyn, our recommendation would be to just privately connect with Paivey to have a more deepened insight on that. I got a question from Arnold as well, privately. He wants to know if you can give any idea on the life expectancy trends of First Nations people, and if there are any positive health impacts from conventional medicine for First Nations.
So life expectancy wise okay, so I wouldn't even possibly answer in this in a appropriate manner, but I want to highlight is that their so overall in the big picture, when we're looking at super large statistics across Canada, we know that First Nations have a lower life expectancy up to 7 years, I think. But I don't cite me on that one because there are super statistics on that on Statistics Canada and elsewhere. But my emphasis here would be that, for instance, in BC, there are stronger and weaker communities. And that doesn't, oftentimes the bigger ones are nowadays much stronger because they have the power in numbers. But I think my message here is really that what really works with and helps First Nations communities is that local context, to work with them and to actually work with them to find out what matters to them in the terms of there are national, they're not necessarily good, but they are getting better, national statistics. There used to be a resistance in First Nations communities to actually respond to Stats Canada inquiries, but that because of a situation and our internal national culture has changed, the statistics tend to, the recent statistics are more reliable and they are available. The generic are available online in any university library, but at the same time, the community specific would be very hard to find. So that's something that, of course, people need to work themselves on. And sorry, I didn't say about the high level, but I think the point is that we know that the statistics are bad in diabetes too. We know that all these classical heart diseases, poverty rates, all those aspects are not so good. And that has something to do with our wonderful colonial legacy. So.
Thank you so much, Paivey. I think we've got time for maybe 1 or 2 more questions. Our next question is from Sulao. He's wondering if what the power dynamic looks like between the Indigenous leaders and the government as it relates to governance.
That's also a question, a whole presentation itself. So Indigenous leadership is also interesting in Canada because you have traditional leaders and then you have Indian Act leaders. Indian Act is the way we and our government sort of in historically controlled people and put them in reserves, and that in modern context, Indian Act dictates or determines, not dictates, determines that every 2 years there has to be an election, and so there are elected chiefs and then there are traditional hereditary chiefs, and that is not necessarily and most often not the same case. And the difference between and what we saw in here in BC not so long ago, is the biggest difference is that the reserves where people live are those, again, determined by Indian Act, where they previously were not even allowed to leave without the permission from the Indian agent. They couldn't go to see their kids. They couldn't go and sell their eggs or cows or chickens or harvest. And these documents can also, by the way, be found online. But those are the small postage stamp size areas where we call the reserves, where the Indigenous communities formerly live. But the traditional territories were much larger, and the traditional hereditary chiefs govern those, and in healthy communities, they work together, and because of all the trauma, sometimes there are disagreements. And then so that in itself creates sometimes tension that was created by Indian Act and government. And then the government not recognizing the nation to nation and the equal foot negotiation power. That's where the power dynamics comes to play, is that we still have a very colonial approach to telling First Nations what to do and what they can do, and when we like their opinions or when we don't like their opinions. And I'm saying we because in this case, I take a part of responsibility being a newcomer and settler, even though I'm the first one in my family ever immigrating. I hope that answered a little. So there are significant power tensions in way of language, process, attitudes, legal aspects, and so on and so forth. First Nations in Canada had, in most cases, more democratic and consensus-based, relatively good systems in place before we sort of came and messed it up.
Perfect. Thank you so much, Paivey. So we just have one question left, if you could just answer it very briefly, and then we can wrap up. So this is from Mira. She says that she appreciates that there is more conversation around respecting wildlife in policy that acknowledges and even integrates First Nations perspective. But in your experience, do Indigenous perspectives value wildlife just for the sake of a fellow life form? Or do conversations revolve mostly around wildlife as resource for human benefit?
That's a huge question. Yeah. I don't speak in behalf of First Nations people, and every culture is different, but the fundamental is that, so First Nations traditionally don't talk about resources, they talk about all our relations. And in that, the whole conversation about ecosystem services is offensive to that relations discussions. But there are First Nations communities who have chosen to buy pipelines because that's the way they choose to be in power. Better be in the game than totally outside of the game. The same way the communities are very, very different, but in general, there is that stewardship relations. All of our relations refers to the earth and so the land and the waters. You take care of them, they take care of you. You see things as relations. I think that's as anything that I can say, because I don't think I should be going and telling my perceptions of how things are, because that's also what I think is very dangerous in me speaking on behalf of First Nations. I'm only speaking on behalf of me as a North American Indigenous person, in the way I see as a researcher how we can work together, and the things that I've learned through my own mistakes and understanding based on my own cultural backgrounds that are somewhat similar in some aspects, but not at all in some others. Mm-hmm. So that was a very long answer again. So I think there's a fundamental worldview difference, the stewardship principle, and that reflects the relationship to animals.
Awesome. Thank you so much, Paivey. So I would like to wrap up now and not taking any more time of people. So I'd like to thank again Dr. Paivey for giving us an amazing set of information, and to everyone for attending today's session. Apologies for it going on and extending for more than we anticipated. I hope we could go further with the discussion too at another time. I'm sorry if anyone ran into any technical difficulties during the session. We'll make sure to follow up with all the registrants with the recording, as well as further information to just keep these discussions going on. I wish all of you a good rest of the week, and take care, stay safe and healthy. Thank you so much.
Thank you.